In the interest of keeping the public safe from harm, and in the interest of expanding true justice in our criminal justice system and advancing economic inclusion, I will work with the legislature to legalize, tax, and regulate the sale of recreational cannabis in Illinois.
Welcome to the Healthy You podcast from NorthShore University Health System, where we tackle trending topics in healthcare. Medical marijuana being prescribed for a growing list of ailments, recreational pot legalized in states around the country, Illinois just being the latest, CBD shops popping up all over offering creams and lotions and drops, even pot for our pets. Marijuana is in the air, so to speak.
If it's a powerful enough substance to cure your migraine and your IBS or help you with sleep, it can have a dark side too. And I think we have to have a healthy respect for that.
I'm Andy Buchanan, and today on the Healthy You podcast, we're talking to Dr. Leslie Mendoza Temple, the medical director of the Integrative Medicine program at NorthShore University Health System, and someone who's been on the front lines of this issue. I want to start off actually with kind of a really general question, because obviously medical marijuana has been in the news. You also served on the Illinois Medical Cannabis Advisory Board. So, I mean, what are your thoughts just in general about these developments that are going on?
I think that we're seeing two phenomena. One is the medical folks who are needing relief from their pain and trouble sleeping and chronic conditions that standard Western medicine hasn't fit the bill for, which is why my role in integrative medicine has naturally led me to looking at medical cannabis for my patients. And then we have the adult use or recreational side of things where it's being used as a substance for many, many purposes, definitely abused, definitely with its issues of increased emergency room visits and car accidents and addiction issues. It's just a substance. It's a plant that's been growing for millennia, that's been used by humans for thousands of years for medicinal, recreational, and also religious purposes. It's how we use the substance and what the intent is to use with this substance that matters the most. So when people ask what's the difference between medical and recreational cannabis, I look at why are you using it? How often are you using it? Where are you getting it from? And is the source of the cannabis from a safe place?
And if you went back from 5 years ago and we're sitting here, would you just kind of be shocked at the developments that have happened?
I am shocked. It has been mind-boggling how quickly things have moved, how the public opinion has changed so quickly, but also the physician opinions have really changed. But what's interesting is that in the New England Journal of Medicine a few years back, there was a case that was presented of a person with cancer who had a lot of nausea and pain from the cancer and the cancer treatments. And they put out a poll of readers who said, would you support medical cannabis for this patient? And there was a strong, overwhelmingly positive response. But the reality is when patients are coming to see their physicians, they're not necessarily getting certified because we as physicians primarily have not been trained on how to use this as a medicine. We've been trained how to look at this substance, not as a medicine, but as a substance of abuse and how to get people off of it and what we should look for in toxicity. But to use it as a medicine, that was never in my training. So if I look back even 10 years ago, I can't believe the things I tell my patients today, like, here, take some cannabis and smoke a joint at bed and maybe you'll go to bed. Like, never in my wildest dreams would I ever think I'd be saying this to patients. But smoking's not the best way to do it, but there are caveats on that, which I can explain later.
Sure. Can you talk a little bit about the science of marijuana and just tell us, what are the components? What is it that gets us high and what is used more on the medicinal side? You hear a lot about the component THC, but then also CBD. And so if you could just talk a little bit about that, that'd be great.
Sure. So cannabis sativa is a really complex plant. And as plants go, there are hundreds of substances in there. our prime substances that we look at are THC, tetrahydrocannabinol, and CBD or cannabidiol. Those are, as we would say, the rock stars of the cannabis plant, but there are so many more cannabinoids that have activities on our brain and on our body, like CBG, CBN, of which we still are scratching the surface on what these things can do. There are also terpenes, which make the cannabis plant smell the way it does. The essential oils, like smelling like skunk or lavender or rose. These are things that also influence how they work on the body. So when we look at cannabis, it's really a conglomeration of things, which makes it hard to study as a medicine. Because in pharmaceuticals, we have one active ingredient. You study that. You can put it up to some pretty rigorous tests and randomized controlled trials because you've got the same medicine each and every time when you test it. But with cannabis, you have an infinite combination of CBD to THC ratios, terpenes, all of them playing into the individual person who's going to treat cannabis differently. So let's say you and I took the same cannabis pill for a headache. We could have polar opposite reactions. And it's the same dose, the same substance, but because of our individual processes of breaking this down, it's so unpredictable, which is what makes this very challenging for physicians to want to certify patients because we don't really know where it's going to go for that person. And I am so used to telling patients what to expect from a medicine, how to dose it, what the timing should be, and exactly what they should take. Right now in the pharmaceutical world, we have a choice between generic and brand name. But in cannabis world, it is a rainbow of options.
Does that concern you? Because I know that's kind of one of the criticisms of this growing use of marijuana, both recreationally and medicinally.
Yes, it concerns me because when I have patients who say, what am I supposed to take, doctor? I give general guidelines. But one of the areas that we could improve on in this with the industry is having the communication back and forth between physicians and dispensary staff as to what they are advising my patients to take. So the fact that, as I mentioned, everyone's going to react differently to different substances in cannabis, the concern is, am I going to send someone off and they're going to have an overdose and be very uncomfortable, possibly visit the emergency room, or just having really bad side effects and then getting turned off to cannabis as a medicine for long term.
Right.
And I have had patients where they've never tried cannabis before, and I made the suggestion because they didn't have a lot of other options. And if they took too much, I would get a call and say, I never want to see that stuff again. Mm-hmm. And my advice from the beginning is always take a very small amount and increase that very slowly. But I have had patients, even despite me saying this, who smoked an entire joint in one sitting, and you're really only supposed to have 1 or 2 puffs. He smoked the whole thing like a cigarette, so I imagine that's about 10, 15 puffs, and he felt rotten for almost a week straight. So wow. We need the guidance for people, especially those who are novice to cannabis, and I really feel that we need to train our physicians and our healthcare professionals to understand this medicine a whole lot more so we can give good advice rather than solely relying on the dispensary for giving our patients all of their education. And I have nothing against the dispensaries, but there isn't any requirement that there are licensed healthcare professionals in the dispensaries in our state. Other states have them where there must be a pharmacist or a nurse or someone with medical training be present on site at the dispensary at all times for challenging situations, but there is one dispensary in Illinois that does have pharmacists on site, but that's really the exception rather than the rule.
And how exactly does it work in Illinois? And you as a physician, do you write a prescription and then they go present it at the dispensary, or is it more you're just advising them and saying, I think this could be an option for you? Or
cannabis certification is a bit tricky because cannabis is still a Schedule I drug. By federal law, this is still illegal. Mm-hmm. And this is another reason why many physicians and whole healthcare organizations aren't even letting their physicians do the certifications. But in each state, we've determined that medical cannabis certification is legal. So I cannot prescribe cannabis because I'm prescribing it like a drug and it's federally illegal. This is all about a battle of nomenclature. It's kind of rhetorical, but what I can do as a physician, and everyone in Illinois can do this as a doctor, is certify a patient for having an eligible condition that has to be debilitating enough to warrant that person's support that they think medical cannabis is a viable option. Even with that caveat, the certification process was designed to have physicians just certify or verify that the person has a debilitating condition and no more than that. But we at NorthShore are taking that further because we want to add more safeties in, that we're not just going to certify people because they have cancer or Parkinson's disease, but we actually have safeties in place where we're having patients read a consent form after we give them the full rundown of benefits and risks. So in essence, I feel like I'm prescribing, but technically we are just certifying people that they have a condition. It's confusing.
And what kind of conditions do you advise on?
So I recently published with Sarah Lampert and Dr. Bernard E. Wigman from Family Medicine a summary of my experience in my early days with my patient panel. And my number one diagnosis that I certified for was fibromyalgia. The second was cancer. The third was multiple sclerosis. And I think the other one was seizures. What I found was that about 29% of those patients had some kind of side effect that they didn't like. And primarily that was psychoactivity. They didn't like feeling weird, out of control, stoned, high, lightheaded, whatever you want to describe that feeling that cannabis can give you. Yet about 88% of them, upon our chart review, said that it helped them with something. And we didn't study the intensity of how much it helped. We've had some people say they had a 180, it was a miracle, oh my goodness, what would I do without this medicine? And then I've had others say, well, it took the edge off a little. I think maybe I'll just keep trying. And majority of them say that it took a long time to figure out what their regimen was, because it is all trial and error.
Yeah.
It's all self-determined, which makes it very challenging for me as a physician who's used to micromanaging that, as we should, prescribing powerful pharmaceutical agents and drugs. We should be able to counsel people on what to take exactly. But this is where I say, well, ask the dispensary worker and go low and slow and good luck. Call me if you have any questions. And many people are like, oh my gosh, that's it? You just want me to do that? And then I have others who are experienced users already and they hit the ground running, but now they're getting it legally and they know where they are, what the source is, and it's, I believe, much safer than what they were doing before, which is getting it from the illegal market.
You mentioned several conditions. So fibromyalgia, that's pain issues, correct? And so it can address the pain. And what about for cancer and Parkinson's? What exactly is going on there?
Yes, sure. For cancer, that can cause either the cancer itself or the medications and surgery or radiation chemotherapy can have side effects. And what I'm looking at for my patients with cancer is to help reduce their pain, to help promote appetite and reduce nausea that may be caused by the chemotherapy or tumor. There's also the insomnia component. Many of these patients are on steroids and they just can't sleep and they're up all night worried about things, and then you have steroids on board, or without steroids, they're living in a very different world. And to help them at least relax and get a few good hours of sleep or more without sleep medications, or reducing the need for benzodiazepines, or reducing the need for opioid medication, I think that's a win. So for cancer, it has many, many applications.
So just to jump back a little bit, you started to talk a little bit about the science of it. So the THC is what gets you stoned, right? That's the element. But there's also this CBD. So what's they're just different elements of the plant?
Yes. So THC is primarily responsible for the psychoactivity, as you mentioned. So psychoactivity could mean anything from feeling euphoric, blissful, creative, giggly, all of the things that you might have seen in the movies, and the reason why people use this and self-medicate, all the way to panic, paranoia, and anxiety. And there are hosts of people who've tried some at a party and they freaked out. And so Imagine you've got a whole rainbow of desirable and undesirable psychoactive effects. So that's THC primarily, but THC can also help reduce nausea, and it is something to help with the munchies or to help people who need their appetites driven. But that could be a side effect for somebody who doesn't need their appetite stimulated anymore. And then we have the long-term issue of obesity from eating too many snacks and junk food without restraint. So it just depends. As we'll always come back to what is the intention of this as a medicine or as a substance? Are you trying to put weight on because the cancer is making you lose your appetite? Or is it helping with the pain from the METs in the spine so that you don't have to take as much Norco? Maybe you can go from 5 pills a day to 3 pills a day. So I look at this as a very individualized program. CBD, you asked about, is the other component which has been known to reduce the psychoactive effects of THC. So I think of THC and CBD as like yin and yang. And so the yang part, which is the THC, which does all that stuff to your brain and can make you feel and act goofy, is with all the other benefits I told you and side effects. It can be countered by CBD, which helps tamper down the psychoactive effects of THC. And that's how we look at plant medicine. There's all these built-in checks and balances that nature has provided for us. Makes it difficult to study as a drug, but also very interesting how we can use CBD as something to help offset a THC side effect. So some of my patients, I'll tell them to take extra CBD from hemp oil so they can calm down a THC side effect.
Interesting. And it is confusing, too, because honestly, you see these CBD shops popping up everywhere. And I was just driving through a neighborhood in the city and saw this big pot plant, in the storefront, and it grabbed my attention. And I looked, and it was a CBD shop, offering oils and drops and a bunch of different products. But it's confusing because, they also claim that it, can reduce anxiety and help with these issues. But it's not the psychoactive component, right?
That's correct.
So what's going on there? It's just very confusing.
Yeah. It is confusing because you see CBD, and oftentimes you'll see that hemp leaf, which is the same thing. So cannabis sativa is hemp. It is also cannabis sativa for medical and recreational cannabis. It's just the same plant. But hemp is grown without THC below the legal limits of 0.03%, where there shouldn't be any appreciable psychoactive effect. And so these hemp plants are approved to be grown and sold to make fiber for rope and clothing, or to have the females shed their seeds. So you got hemp seeds and you can press the oil out of them. From that entire plant, CBD is extracted. And because hemp is available for over-the-counter purchase and everyday use, because it's not a recreational drug, they're selling the CBD that they pressed out of these plants. And that's why you see these available and you can just walk right into a shop. We actually carry CBD products, hemp products, in the wellness shop. And they have been it's been very interesting to watch the reaction my patients have had to saying, it really seems to take the edge off of my pain when I rub the cream on my joints, or if they take it orally, that it helps them sleep. But it's hit or miss. It's still worth a try. But so far, I have not had a lot of reports of side effects that make me worried about this as a substance. What I am worried about is, to your question later on, I know you're going to ask, is what about the proliferation of all these CBD products? I think I heard you can find CBD at a gas station. And that I saw a kiosk at the mall, Northbrook Court. Where else did I think Bed Bath & Beyond carries it. So
Really?
It's like, to me, many people are jumping on this bandwagon. They see money. And what I want to know is, where are you getting your CBD from? So I'd be really careful about buying the cheapest form of CBD that one can find, because this is not regulated well at all. People will ask me, well, I'm on the oil. Oh, well, I'm on the drops. It doesn't really matter if it's oil, drops, in a candy, a gummy bear, in a chocolate. What matters is what they put in that stuff and how much you took. So that means nothing. We want to know, what is the THC to CBD ratio, and to always start with the lowest THC and then bring that THC level up by buying other more concentrated products and trying little bits at a time to get the result you want while staying within your comfort zone of psychoactivity. The other thing to be really cognizant of is not to drive while under the influence of medical cannabis, and definitely not recreational cannabis or alcohol or anything that slows your reaction time or makes you make bad decisions.
So the flip side is there are side effects, and I've read stories out of states like Colorado, which was one of the first to legalize recreational use, and that they have experienced an increase in emergency department visits and issues with, as you said, you shouldn't be driving on it. That's a risk. Shouldn't be operating heavy machinery, anything like that. And so, what types of potential side effects are there? I know there are kind of psychoactive, unlike maybe opioid use, people are not necessarily overdosing and dying in emergency departments, but they are going to emergency departments. Why are they?
Yes, they're going because most likely it's a psychoactive effect that got severe enough that they're really scared and need to make sure that everything's okay. There are some other phenomena we're seeing more, which is hyperemesis, or throwing up a lot after using cannabis, which is paradoxical because it's supposed to help you with nausea. But there's a group of people, and a growing group of people, it's making them sick, nauseated and sick, so they can get dehydrated and low potassium. And yes, it absolutely needs more study because there is so much hype out there that it's a panacea, miracle, harmless kind of substance. And my biggest concern is the message this is sending to our youth, especially those under 25. I think any addiction to anything is not good. I personally don't use any of these substances, so I have no skin in the game when it comes to the recreational world. But I do think that regulating it is really important so that we know where the substances are coming from. They're grown in vetted places that are strictly monitored, and that we're able to actually take the revenue from those sales to help generate funds to educate our youth more robustly, actually, as to the dangers of using cannabis before your brain is fully cooked.
Right.
So we know a lot about its toxicity, but we still need to study so much more how this is working as a medicine. And there is evidence. It's out there, but I have to look for it a bit. But when I hear clinicians say there's no evidence this works, they haven't done their homework.
You see it in your clinic every day, right?
I do. So I have the anecdote, I have the patient in front of me, but I also see the literature, and there's a growing body of literature supporting its use for certain conditions, primarily chronic pain.
But I read the list is upwards of 40 different conditions now,
Yes.
and growing, right? So
yes. They have drafted legislation that passed both House and Senate to expand the conditions to everything that the Medical Cannabis Advisory Board had recommended be added back in 2015 and 2016. But they're going to include conditions like osteoarthritis, irritable bowel syndrome, autism, neuropathy, and other conditions which have to be of a debilitating enough nature to warrant the physician to certify a patient. So it's going to be up to the physician to say, is this debilitating enough for me to write a certification? Because sure, I think many of us are going to have osteoarthritis. Does that mean we're qualified for medical cannabis? And it needs to be debilitating enough that the physician feels like this is a good option. Like, has the person been through physical therapy, gotten injections or surgery, or has tried many medications and those medications failed, or that the whole package is inadequate to help control their pain. So lifestyle, weight loss, all of those things are important. We have to remember that cannabis is just one tool in the toolbox. We have to look at the lifestyle and bring all of those pieces in. And I also get concerned about places that are just popping up cannabis certification shops, so to speak. I just wonder, like, is there an ongoing relationship with those patients, or are we just certifying them and then see you later? So at NorthShore Integrative Medicine, what we're doing is we will do the certification if they are qualified and all of the paperwork's in. Helpful if we get a referral from their physician, but also talk about the lifestyle components of eating a healthy diet, getting the sugar out, the processed foods out, getting stretching and movement, helping the person sleep and find other ways to help them live the best life that they can, because cannabis is only one piece.
We talked a little bit about the growing number of ways and forms it comes in, from candies and chocolates and gummies and oils and creams. I also read about cosmetics. Have you heard that?
I have, yes. CBD primarily in oils to help reduce inflammation on the skin. So CBD is known to have anti-inflammatory properties. I actually saw COX-2 inhibition in one of the studies, which is like Celebrex. But is it as powerful as Celebrex? And is putting Celebrex on your face good for you? So I would say, having tried CBD hemp oil products on my face, it didn't cause me any issues. You could have hypersensitivity and rashes if you're sensitive to that. But I thought it was pleasant. I didn't think it was any better than other cosmetics I've used, but we're going to see a whole lot more of that, and the price point of these products are really, really high. They're crazy. And then we run into that same issue of, if everybody's putting CBD in their products, are they really putting CBD, like really good stuff? Is it tainted with a lot of pesticides? Because as the world demand continues to explode, as a supplier, you're going to try and grow this stuff as fast as you can. And I'm just worried about the people who take shortcuts and, will try and, use whatever it takes, meaning pesticides and other chemicals that we don't want to put on our face or in our bodies.
Yeah, I think I would assume most people would be horrified to learn they were actually putting pesticides on their face. So you've tried CBD products then. So, and what was your experience?
Topically, like I mentioned, the topical experience, which was nice. And orally, it doesn't, I've tried it to see how it makes me feel. I felt a bit relaxed, but for the most part, I, knock on wood, have been lucky. I haven't really had to use it for anything specific. I have noticed that it's taken the edge off of some joint pain in my foot as a cream. And I have many anecdotes of, it helped my patient with her back pain. It helped him with his wrist pain. I think because the risk of trying these is very low from a toxicity standpoint, it's worth a try for any external joint pain to apply some cream on there. What is a risk is the financial risk of it being quite expensive at about, could be anywhere from $30 to $100 a jar, and for not very much.
Wow.
So most people you're gonna want to use it sparingly, just so that you don't go broke trying this.
Right. And we're talking CBD.
CBD
products.
from hemp oil.
Right.
Now there's CBD and THC, the infused cannabis creams that you can get from a dispensary, where there's THC in the cream. And I'm still trying to assess whether there's any huge difference in what my patients are saying. Because I have patients who sound like they are just as happy with the hemp cream as they are with the cannabis-infused creams with some THC in it. But I don't have enough people to make a very good judgment about that. So I say, just keep trying and see what works for you.
Yeah. I also read about it being used in dog food.
CBD, yes.
Yes,
and
really?
oil and drops, yes, that it might help their joint pain. And talk about a captive audience of people who, not people, of organisms, of animals that are going to tell you whether it works or doesn't. If they start jumping and playing, it's working.
They don't get to consent, though, to be
no
part of
consent.
the study.
Most likely no placebo effect that we have to deal with. It works or doesn't work.
That's true.
Yeah.
Now, you bring up a really good point. I'm wondering how you see your role with the legalization of recreational pot. As you said, if I might be a patient with cancer and say, well, I don't need to go see Dr. Mendoza Temple anymore. I can go get it on my own and smoke it, but do I, again, really know what I'm getting, and I'm not really doing the dosage right? Does that concern you? Or
it concerns me, but there are going to be a lot of people who are probably going to turn to that. And I feel like if a person's got cancer and they have many other substances on board, like the steroids and the nausea meds, the chemotherapy itself, or hormone ablation treatments, there's such a complicated stew of pharmaceuticals. You really need to check in with the physician on how should I time the cannabis? What should I take? What should the components look like? But I'm sure there will be folks who maybe aren't in active treatment and say, I'm just going to go get some. And there may be a little blurring of the line between, I'm going to get some for quote unquote, and I have my hands in air quotes, medical purposes, but really using it for recreational purposes. And that's where we bring it all back down to the intent of why are you using this substance? Why would one use alcohol to relax? Is there an addiction? There's so many aspects that if a person's just doing this on their own, you can run into more pitfalls. Because cannabis, despite what I've heard in the myths that it's not addictive, it actually can be 9% of the time. Cannabis can be addictive, and we have to keep in mind there's a subset of people who are in treatment programs and suffering greatly from being unable to get off of this substance. So we have to have a healthy respect. If it's a powerful enough substance to cure your migraine and your IBS or help you with sleep, it can have a dark side too. And I think we have to have a healthy respect for that. So I have a billboard I want. So as you asked me, what do I think my role is going to be, now that for a while I didn't know when legalization was going to happen, but now I feel my role has taken on an additional obligation to educate the people about what are the side effects and the risks of recreational cannabis. What do we really know about it? And to provide a very balanced, non-terrorizing yet, culturally sensitive, age-appropriate message that says things like, here's what my billboard would say. 1, cannabis can be addictive 9% of the time. Don't fool yourself. Number 2 is if you are to try an edible, never eat a whole piece. Wait 2 hours. 3, don't drive. I might change the order because I think number 1 should be don't drive while under the influence. But don't drive while under the influence. And 4, don't use this regularly or at all if you're below the age of 25 before your brain is fully developed. You may risk loss of IQ points and the ability to motivate yourself for your own pleasurable activities. So on that note of youth abuse, when you have a substance that's doing all of your dopamine releasing for you, and dopamine is the chemical that gives us that sense of pleasure and reward, that part of the brain becomes underdeveloped. You've got something else doing that for you. And so we have the issues with lack of motivation, but also there's an intelligent part of us that doesn't develop to find our own ways to feel pleasure and reward that you may not get because cannabis has been doing it for them this whole time. So I think about losing IQ points and being stuck to the couch as a potential risk. Does it happen to everybody? No. I've heard stories of, I smoked pot all throughout law school and I turned out fine. And I say, you could have been a better lawyer.
Yes, yeah. I would imagine you're not necessarily seeing patients coming in just saying, I want that medical pot. There are people who have tried other stuff and kind of that hasn't worked, and they're kind of sick and tired of that, and looking at this as, hey, maybe this will work.
You've described my patients.
Yeah, good.
Pretty much. Many of them who've come in and had to wait because there aren't that many of us that do it. So that's precisely the patient. Then I also have other patients where they come in and they're just looking for answers. They're not sure what they want, and some of them still don't know about medical cannabis, that it's possible. And I still get that, what? You really? You're suggesting that? And I will do it if they have had back surgery, multiple epidurals, they're on multiple pain meds. I will still recommend healthy diet, acupuncture, massage, mind-body therapies, but I'm now able to bring in medical cannabis as a possibility, starting with hemp, which is a nice way to start for folks who are beginners, and then create a relationship with that patient of trust to see, okay, you want to try this? You don't want to talk about cannabis now? We'll talk about it at another visit if we need to. Try some other holistic approaches and see where that individual can go.
Now, you're in integrative medicine. Can you just how do you describe that to people and what you do?
I guess the elevator speech would be use whatever works. But
really?
Yeah, well, not whatever works as long as it's safe and legal. That's the second part.
Right.
So it's a combination of Western, conventional, or allopathic medicine, like medications, surgical procedures, testing, all the things that I learned when I became an MD and did my residency here at NorthShore of all places in family medicine. When you make it integrative, where you incorporate complementary therapies like traditional Chinese medicine, massage therapy, body work, ways to help reduce stress with meditation, and all the different schools of thought on that. Herbs and supplements, which we have not received much of an education on in medical school. So using natural products safely in conjunction with medications and checking for interactions and such. So it's really I wish medicine was just like this, because this doesn't have to be integrative medicine as a specialty. This just should be good medicine.
So in your ideal world, there maybe won't be a specialty of an integrative medicine. It'll just be physician.
Yes, good medicine.
Right.
Good medicine. Try, and this is part of our Hippocratic oath of, first do no harm, and then we bring in harm later on when we need to, if there's a condition that requires something that's more invasive or potentially more toxic. And I think with integrative medicine, we're that first step, because many diseases are from chronic lifestyle habits, and others are not, that you need I would want an appendectomy if my appendix is inflamed. I'm not going to chant over you and send you herbs. So you go to the ER for that. So knowing, and as physicians, an integrative trained physician is going to know when do you call it, when do you have to go get that pill or go to the surgeon or get the chemotherapy. But my goal is to also soften the blow of the side effects so that you can keep getting the chemotherapy and one can heal well from the surgery. For those who are learning more about medical cannabis, there's a book I like called Cannabis Pharmacy by Michael Backes, Backes. And the website leafly.com, Lefly.com, are some good resources to get your homework done, whether you're planning or using recreational or medical. It gives a good background on what you're putting in your body. What are the differences between strains? What is CBD and THC? What about the other components that I barely scratched the surface on today? Because I think that anybody who's going to go into a dispensary, for whatever your intention is, be informed. Just like when you go into the wine shop and you want something that's more oaky and cherry or less alcohol in it, do your homework first so you know what you're doing. The other resource, if you are a medical professional or you're just really interested in learning about the evidence base, is the National Academy of Sciences primer that they wrote on medical cannabis, the state of the science. And that is actually online for free, and it's a tome. It's huge, but it has sections that are very user-friendly where they go through what is the risk of cannabis and lung cancer. People who smoke cannabis all the time, they actually have not found a relationship to date that it causes lung cancer or makes it worse, but we do know that smoking cannabis can increase your risk of bronchitis. So the people with COPD and asthma should not be inhaling anything. So it has that kind of information in there, and if you just Google NAS and medical cannabis, you should be able to find that resource.
And what about does the NorthShore website have information about your program?
We do. So our website is northshore.org/integrative. And I would love for people to take advantage of the acupuncture services, Chinese herbal medicine consultations, nutrition. The wellness shop is actually one of the best sources of vitamins and supplements and medical foods that I've ever seen anywhere else. And so I think that that's a resource that should be tapped, as well as the massage therapists that we have. We have 2 talk therapists. We're located in the Park Center at 2400 Chestnut in Glenview. And it's a really great team. We've been together 20 years, and I hope to be working with them much longer too.
And the wellness shop is there, or is that an online thing? It's an actual shop?
It's an actual shop, so you can go in there. And I would say that the herbalists in there have more expertise than you're going to find in any of the retail facilities you see around town.
Yeah.
And you might as well help support the program. No one makes any individual commissions. We just carry what I think are some of the best products because they're pharmaceutical grade, so you're not going to find these just anywhere because the companies are only allowed to sell in physician offices. And I feel that if you're going to take an herb or supplement, don't waste your time with inferior products because you do get what you pay for.
Yeah. No medical pot there, though.
No, but there are CBD hemp oil products.
Oh, really? Okay.
Yes, actually they carry I think, the best. So don't go to the gas station.
You're right.
You don't need to go to Bed Bath & Beyond.
Right.
keep buying your towels in there and all that. But the CBD, I feel like people are really stepping out of their lane on this.
Yeah.
And then what if there's a side effect? Are you going to talk to the gas station clerk?
Right.
You know?
Right. Not a lot of expertise there.
No.
Yeah. All right. Well, I'd like to thank Dr. Leslie Mendoza Temple for joining us today and talking about this fascinating topic.
Thank you so much.
Thank you for listening to this episode of the Healthy You podcast from NorthShore University Health System. I also want to thank Dr. Leslie Mendoza Temple for taking the time to talk to us, and also thank our producer and editor, Jon Hillenbrand, for helping put this together. Please continue to tune in to the Healthy You podcast as we explore hot topics in health and medicine.